Hi, I'm Elizabeth Hess. I'm here with Julie Pryde, the administrator of the Champaign-Urbana Public Health District. Vaccines, vaccines, vaccine. That's all anybody's talking about. Julie, here in Champaign County, I know the national rollout has been slow. Have we fared better here locally?
Well, we have fared better in the sense that as we get them into people. So that's a good thing. We have a lot of community partners helping us. What we're not getting is as much vaccine as we would like. Of course, no one is, but that's really where the problem is the getting it from the federal government into the states. So hopefully that will pick up soon. And, we're just going to keep adding more vaccine into the strategic national stockpile. They're going to just keep passing it out. And they'll probably add different vaccines as they become available. So, from this moment on, I look for the access to do nothing but increase. So that's a good thing.
So we started off with medical workers and health professionals and nursing home residents, and now we're moving on to 75 and up. So have we completed vaccinating everyone who wants it in those first two groups?
Well, we don't know, but the thing is, we know that everyone that has been on any of the lists have been vaccinated, yes. But it's important too to know that if somebody changed their mind and now they decide they want it, but they work in healthcare and they didn't get it, they're still eligible to get it. It's not like you have to get it right during that little time or you are no longer eligible for it. So yeah, we're starting the 75 and ups tomorrow. I'm jumping the gun a little bit. I accidentally kind of moved them up the list. But we're also doing, starting today, we're getting, first responders as well. We're not starting today, but we're working on first responders as well. And one thing that is important for our community to know is that there are two parallel processes going on here. We have the long-term care and, the nursing homes, assisted living, things like that. They are being contracted. They have contracted with the federal government to bring in the national pharmacy chains. So they're going through that, working to get everybody vaccinated through that, while public health departments are working on a parallel track with all of our community partners to get everyone else. So while we are going ahead and moving on, there are still people in nursing home and assisted living that need to be vaccinated. But that is, again, that's a different track than what we're vaccinating. So that's important for people to realize, because while some places have already been vaccinated, other ones have not yet started.
If you get the vaccine, the first dose, Pfizer is 21 days later. If you get Moderna, it's 28 days later. Does it have to be exact, or is that the earliest you should get it?
Yeah, that's the earliest you should get it. It does not have to be exact. But, we definitely want to get people back on the schedule that they're given. So when you get vaccinated, you'll get a little card and it will tell you the type of vaccine you got, and it will tell you the date to return for your second vaccine. So we're hoping that we get everybody back on the date that they're scheduled for, assuming we have vaccine, which we certainly plan to have, but anything can happen.
Why is it so important to get that second shot after you have the first one? Why is that booster so crucial?
Just because it ups your immunity, so your percentage of protection is increased. So that's why it's important. Now, of course, they're still looking at all options out there based on the amount of vaccine we have. So I know that the CDC and other places are looking to see if maybe we can just do one shot of one type, two of another. They're looking at all kinds of things. But right now, as it stands, we have both Pfizer and we have Moderna, and people will be told to which one they're getting. You don't get to pick and choose which one you get. It's based on, what we have and where we are. So we want them to get the first vaccine, keep a hold of that little card, and make sure you get back for your second dose as soon as you're eligible.
If I get both doses and I want to visit somebody who hasn't, I'm vaccinated, but could I still be a carrier?
Well, that is the concern. There's not 100%, they don't know for sure, but it is possible to be, the vaccines are going to prevent you from getting, a serious case, hospitalization, or death. But does that mean that you can't get like a mild case where you still have it in your nasal area and you cough or sneeze or breathe or talk on someone, and then you can spread it while you're not sick. So until that's known for sure, we all need to continue doing the masking and the distancing.
As doses come into Champaign-Urbana, where are they stored and how long does it take in order to get them in people's arms? What's the process right now?
Well, interestingly enough, we're not really talking about where the vaccines are stored. I can tell you that they're being stored securely and properly. Let's just say that. So if it's Pfizer and it requires the ultra cold refrigeration, we have that in various places in our community, including CUPHD, including the hospitals, including U of I. So they're out there, but we don't really talk about where the vaccine is being stored because there are, it is a scarce resource and there is a potential for someone to either try to get it or to destroy it, what happened up in Wisconsin. So, but anyway, so the process is that it does come into our community. And then once we have it here, we get it, whether it's going to be through clinics or through, well, right now they're through clinics, or when they're in the pharmacies or whatever, they'll be stored properly, then they'll start getting out. It's not like we are, just holding on to the vaccine because there is a shortage of vaccinators or anything like that. As soon as we get the vaccines and we get the clinic scheduled, we are going. And we have a lot of help. The U of I EMTs and Illinois Fire Service Institute are helping us. We have, medical providers helping us, medical students, Christy Carl, Francis Nelson, McKinley, OSF, everybody's really on board, just like they were during H1N1 to help us vaccinate as fast as possible.
People are frustrated that things aren't open, that we're not moving into the next phase. Area 6, we're doing great here in Champaign, a little worse than we were last week, but what's it going to take in our region 6 in order to move forward and open more things?
Well, we have to have a positivity rate down under, 12% to be able to move back a tier. We need to get it down below 6, maybe. I can't remember exactly right now, sorry, but we need to get, it's all metric based. So we need to get those numbers, moving down in our entire region, which has been a struggle this entire time. And the reason why, again, is because other communities do not have the cooperation and the cooperation that we have here. So it's been a struggle, definitely. And, we want to see our stuff opened as much as anyone does, believe me. So we're just going to continue trying to keep doing the hard stuff, the masking, the distancing, get people vaccinated as fast as possible. And as soon as we can, we're moving out of this tier 3 mitigation. But I think probably by the end of the week, by Friday, they should be looking about moving places out if we're ready.
That's a good time for you to go over the numbers with us. How are we doing in our area right now?
Right now, let's see, we have 856 cases in isolation. We have 23 hospitalized from Champaign County. We have 982 people in quarantine. Our regional positivity rate is 9.9%, which is low enough to move out of the mitigation, but not low enough for like indoor dining, which is what everybody's interested in. County positivity rate right now, our county, excluding the U of I, is 6.1%. So, we definitely did see a bump from the holidays, and we're hoping to start seeing that start tapering down again. We don't want to see the, right now is a high hospitalization rate of 23 Champaign County residents. That's pretty high. But we just need to keep doing what we're doing, and hope that doesn't get much higher. So that's what we have to look at. We have to keep looking at those same metrics that I keep saying over and over like a broken record. It's literally the same. Have I said anything different in all these shows since the beginning? And we knew that it was going to be, things change, but some of the basics are going to remain the same. And the masking and distancing really are key to preventing infections.
Local schools have been working with your office to determine if it's safe to go back. Is it safe without the teachers vaccinated? Kids can be carriers. Are we looking at jumping the gun?
Well, the thing with the schools, a lot of them are, big, they have big space, and their plans are good. Most of the plans that we have looked at have been really good plans. The key is the same as it is with any place: keep the masks on and stay 6 feet apart. So there is no reason why they can't go back, safely. But again, mitigation has to be followed. I always use our facility as an example. We have in our emergency operations centers, for example, everybody's in there. They're about probably 7 feet apart. Their desks are 7 or so feet apart. Everyone wears masks. We have had at least 10 people who are staff members who have come in positive before they knew it. And we have not, knock wood, had any spread from that. So you can't prevent anyone from coming into your facility, your workplace, your school, but you can prevent an outbreak. So that's, as long as the schools are able to do that, then, that's fine. And that is the key. Some have been trying to, put too many kids into a classroom, and it's just not going to work, because if you get a case in there, you're going to have an outbreak in there.
Let's go back to vaccine distribution. I feel like there are two very loud, vocal schools of camp. There's the thought that I'm not going to get the vaccine at all. It's not proven, it's too soon. And then there's the camp of people who want to jump the line. My church, my private school, my parochial school. Is there that middle ground where there are people like, you know what, I'm willing to wait my turn? Have you heard a lot of that middle ground?
Oh, that's the vast majority of our community. That is the great thing about living here is, yes, we just have a great community. We have a caring community. We have a community that considers other people for the most part. And that helps a lot. So while I completely understand people wanting to get this as fast as they can, if there's someone interested in getting it, they're still doing what they need to do and waiting. We did have the issue where there was some confusion when we first opened up slots. You may remember that. There was an email, one of our emails, that was not to be shared. It was just to go to healthcare workers or the people that were on the list to help them sign up for it. And those started getting shared with the belief that there was somehow vaccine out there that was available, that was going to go to waste if we didn't get it in people. So that was a myth. The document, however, was circulating. I got it from many, many people, and I had to tell them, no, that's not what's supposed to happen. Did some people kind of sneak in on that? Yes. But did they do it? They did it. I think they did it assuming that they were doing the correct thing, because it was going around in our community via email, but it just wasn't. That's not how it was supposed to work. So we did get that taken care of. But people are just, signing up. I can tell you that this has been, last week, we had 22 people answering the phones to make appointments for people 75 years and older. And people could do it online for them. And they could go in through the Carl May site. So there was a lot of ways to get people registered. And even though they were just absolutely busy with nonstop calls all day long, for a day and a half, it was really a morale booster, I think, for everyone, because, we all want to see the vaccine to start flowing, and we all want to see those most vulnerable to get vaccinated. So, and they were happy, the people that were calling in were happy. So that's nice. I'm very much looking forward to these clinics this week. I really am.
My parents are scheduled for the clinic for next week, and it's been a very professional process. They want to know, are they supposed to stick around? Is our vulnerable population supposed to stay in a parking lot for 10 or 15 minutes afterwards to make sure they don't have a severe reaction, or is that a myth?
No, they absolutely have to, but not in the parking lot. So what happens during the clinic is you'll come in and you'll get the vaccine, and then you'll be put over in an area, socially distanced, where you'll sit and wait 15 minutes. We'll have medical staff watching the whole, audience for any, well, it's not an audience, but it'll look like an audience, but they'll be watching all the chairs to make sure, that everyone's okay. And then if there were to be a reaction, then we'll have medical staff there to deal with that as well. But yes, they do have to do that. But these are inside clinics. These are not drive-through clinics.
And the encouraging news, I just looked up the number, 29 out of 2 million cases have had severe reactions. That is a very low percentage. That's encouraging news.
Yeah, that's very encouraging. It is. And, once they look into those, they'll find out if it was vaccine related or if it happened to just be, a coincidental, some type of issue. But yeah, I mean, anyone can have a reaction to something that they haven't had before. That's certainly possible. Most everyone has said it's basically like getting a flu shot.
So before I let you go, final word, just talk about being patient and waiting your turn, and you will get the call. You will get the email or letter, correct?
Correct. So what we're doing now is, while we're doing the clinics, we're planning for the next clinics. So we're working through our list as we go. We want to finish up, make sure all first responders are vaccinated, everyone who has been in 1A, so all the healthcare providers, if they didn't take it, but they want to take it, we're making sure that they're getting it as well. And then, next up, we'll just start working through the list. We believe that next Friday, they're going to move officially to, wait, what is the date? I'm so confused. The 18th, yeah. So next Monday, it would be moving to 1B. But again, I don't want people to get too excited about that because it's all dependent on how much vaccine we get. And, but we will start, as soon as we announce who's next, then we start working through that process. I just wanted to talk a little bit about how we ensure equitable distribution. Mm-hmm. So if we only did, for example, like a press release and it only went to the news, there are a lot of people who don't watch the news, who don't read a newspaper, so they might miss it. So what we did with the 75 and older is that we got all of our materials together ahead of time, our press release, our flyers. We made sure that they were in English, Spanish, and French. And then we, at the same time, our public information officer was pushing them out through the press release, through the media and through social media. Then we were also sending them out at public health through our contacts, whether that's in the disability community, the non-English speaking communities, through churches and religious organizations, through social service agencies. So we were pushing it out there too, so that they could then push it out and make sure that their constituents or their clients or their congregation or whomever were able to find out about it as well. So that's how we're trying to make sure that people find out about it. They have an equal opportunity to find out when it's their turn, so that somebody's not accidentally kind of knocked to the bottom of the list because they don't have access to the information.
As much as we want the vaccine, you want to put the vaccine in us. There is absolutely a widespread effort to let every single person know it is coming, correct?
Absolutely. And again, you'll be hearing it. You may hear it 25 times from 25 different places, and that's just a good thing. So
it's a great thing.
And again, I need to thank all of our community partners that are going to be putting these clinics on this week, because it is a very large effort to get these vaccines out.
I want to thank Urbana Mayor Diane Marlin. Let us continue to do these until we have everyone vaccinated and mitigation, Julie. I want to thank Jason Liggett. He's our amazing producer with the City of Urbana, UPTV, great programming, check it out. And of course, Julie Pryde, Administrator of the Champaign-Urbana Public Health District. Couldn't do it without you. Thank you.
Thank you.